Welcome, everyone, to this month's Roundtable, Public Health Roundtable Live. I'm Dr. Huntley. I am your host for this roundtable. So every month we come together. Sometimes it's a slightly different group of panelists that join me, and we discuss various topics of interest. And this month there's a lot of focus for this month, but we chose to niche down and talk about Alzheimer's and Brain Awareness Month. So we're going to be sharing on that topic. But before we dive into it, I want to give an introduction. We're going to pass the mic around, let everyone introduce themselves. I'll go first since I'm already talking. I am the CEO of DrCHHuntley, LLC. We are a public health consulting firm that specializes in epidemiology and specifically providing support to large nonprofit organizations that are serving BIPOC communities. We also provide support to government organizations that are genuinely interested in engaging and supporting BIPOC communities. And where we specifically fit in is, in a sense, helping them relate or communicate their health information in plain language. That's probably the simplest way I'd say it. So epidemiology can be very complex and a little scary. So we just help to communicate that in plain language. So it looks a variety of different ways, but connect with me and reach out. And if you have any other questions, I'm going to ask Dr. Joy to introduce herself next.
Hello, everyone. I'm Dr. Joy Washington. I am a community engaged research consultant, and I am CEO of Joy Washington Consulting, LLC. And so we really help organizations to successfully implement their community engaged research strategies. So our mission is to really revolutionize public health by transforming public health research into life-changing public health solutions. And so we accomplish this by working with community-based organizations, nonprofit organizations, public health organizations to build meaningful community partnerships, conduct impactful research, and then also create data-informed solutions that bring joy to our communities. So if you need anything, if you need a strategy session, if you need to know how to better implement or successfully implement your community engaged research strategies, please feel free to reach out.
Okay, I love that, but I'm going to have to jump. I'm such a fan of your podcast. And since I was recently a guest on your podcast, let's give a shout out. What is the name of your podcast?
Yes, I am also the host of the Public Health Joy podcast, which is a safe space where we have real and honest conversations about creative and innovative approaches to public health research that is done with, for, and by our communities. So you can check it out on Apple Podcasts and Spotify. The last conversation we had with Dr. Huntley was amazing. So if you haven't checked it out, please do so. And so we look forward to you joining the conversations.
All right, let's pass it over to Judeline. Introduce yourself.
Good afternoon, everybody. My name is Judeline Casimir. I'm the CEO of Casimir Public Health Empowerment. We specialize in community health research, public health education, and we have a deep passion for the migrant community. So all my information is on LinkedIn. If you want to reach out, if you have a project that you want us to work together on, you can find me at Judeline Casimir MPH on LinkedIn or on my website, casimirphd.com.
Absolutely. I'm going to add on to that since I'm such a cheerleader by nature, of course. But I think that it's important. We always talk about having these difficult conversations and engaging with community. And we as a public health industry, it's something we need to do and do more of. Sometimes there's this moment where an organization really wants to or needs to, but feels a little paralyzed. They don't know how to or what to do first. They're a little afraid of getting it wrong, so they do nothing, which is even worse. So that's where having a connection like Judeline with the Haitian community and Dr. Joy within the research community, that's why we are here and we can have these conversations. So if that resonates with you and a project that your company is working on, reach out to any of us and we can talk about it. We can see, what we can possibly do to help you. All right. So with that in mind, we are going to dive into our discussion for today, which I'll share it. This is just the topic. Alzheimer's and brain awareness is the theme in the month. And my question is for each of the panelists, how are you leading and engaging in Alzheimer's and brain health awareness conversations with communities that you serve? When I first started working as an epidemiologist within the pharma industry, my first project I was assigned to was Alzheimer's disease. And I was responsible for estimating the patient population on a global level. So not niche down by ethnic groups, but more by country and by age and gender. And we compared those countries, basically the markets. And it was all part of helping to address better treatment. That was my first project. It was an awful project because it was a great project, but I was new and it was a whole different way of thinking. But I was also responsible for updating that for year after year after year. So I got really familiar with that over a stretch of about 4 years. So within this topic with Alzheimer's Association, the reason I like their website is because there are a lot of resources for identifying symptoms and even some tips on how to have the conversations with your loved ones, things to watch out for, and reading some of the other stories. I'll just read one statistic. Worldwide, more than 55 million people are living with Alzheimer's or other types of dementia. So it's something we can't ignore. I mean, we have a whole list of these public health issues. This is one of them. So this is a great resource. I encourage you, not now, keep watching us and hanging out with us for this conversation, but afterwards, to check out some of the resources there. I will share on a personal level. Before my mother passed away the end of the summer last year, and a lot of you are familiar with that story. I've shared it, but she and I've had a lot of conversations about Alzheimer's. But she was really concerned. She was always, I won't say they're just like afraid it would happen, but she was always aware that, when that difference between, like, I have a lot of moments where did I put my cell phone? I can't tell you how many times I chase around looking for where I put my cell phone or my keys or whatever. But then there's a difference when it spills over into this memory loss that affects your life, your daily living. And so she was always aware when she'd have moments where she forgot things, she would start to think, is this a pattern? Is this something, different? So we just had conversation where, we made a pact. I would, let her know if I noticed any pattern that seemed out of the ordinary, because I was the closest to her physically. We were like about a 10-minute drive. So I saw her really often. And we had that agreement that we would, I would let her know if I saw something differently, and she would let me know if she felt that something was out of the ordinary. She had a really good relationship with all of her doctors. She talked about every last one of her ailments. She said, I'm not a doctor. Y'all are doing this thing. So I'm going to tell you everything. You decide what's important and what's not important, which was a great place to be. So she was like sort of one example of a family member in the way we had conversations. And then right now we're going down this journey with my father-in-law. So also my mother-in-law passed away early last year. So my father-in-law is by himself. So my husband and I he's a few states away. So we're trying to navigate the conversation with him. The different personality. He's not as open. And so it's very difficult. So this is very timely, very relevant for, I think everybody's can relate to it on a whole different spectrum, personally, professionally. But I think that it's just something that is very timely to be discussing, not just this month, but always, really. So with that in mind, we're going to go to Dr. Joyee first, just in the same order we did introductions. And this question is for you. How are you leading and engaging in Alzheimer's and brain health awareness conversations with communities that you serve?
Yeah, I think one of the things that's important to mention is I have a personal touch as well. Alzheimer's and dementia has touched my family personally as well. I had an aunt who I was very close to. And the thing about it is it's hard. It's hard to watch. It's hard to see your loved one go through that transition and see them not being able to remember names or remember faces or remember their environment and see their personality change. And one of the things that I want to bring up is it's also a broader conversation, right? It's not just about the health of the person who's experiencing Alzheimer's or dementia. It's also a wider conversation about the health of the caregiver or caregivers, right? So when we're talking about public health, we're always talking about a system issue. And so we have to remember that the caregivers are also part of that support system when it comes to the patient, when it comes to your loved one. The support is extremely important. And it's also important for us to see the lived experiences, right, of our communities, Black communities, African-American communities. There may be other cultures who experience this as well, but we have to be able to acknowledge the health disparities and the health inequities as it relates to Alzheimer's and brain awareness and brain health. And so one of the ways that I am working with communities is that I am currently working with an organization on a film project. It is called the Mama Joe Project. And so it's going to be a film that is going to be released soon. So be on the lookout. It's going to be released soon, hopefully early next year. But the Mama Joe Project is a multimedia and outreach initiative that's focused on aging and care for elders with Alzheimer's disease and other dementia, specifically in the Black community. And it follows the story of Mama Joe and Mama Joe's and her family's experience with Alzheimer's and what it looks like to navigate this system. And because we are sharing the lived experience through this film, we are also focused on not just showing the film and the lived experience, but also providing resources. So we're in the process of developing community outreach and engagement events to deliver resources around this for Black communities and families, because at the end of the day, we have to make sure that we have the support that we need and understand that experiencing Alzheimer's and dementia and going through that process in a Black family, there's a cultural responsiveness that needs to happen. So please be on the lookout. I'll be sharing more information soon, but it's really about the story that intersects the personal narrative, that lived experience with broader themes of aging, health, caregiving, and addressing health disparities.
Wow. I had no idea. So now you're an actress and no, I think that is wonderful. What a great, I can't wait for this to come out, but what a great concept and a great way to teach, a great tool, a great way to share a story, to teach, like you said, this like multifaceted angle. Like there are so many different views and perspectives as we approach this topic. So congratulations on that. That's a great project.
We are working on getting some community-based film screenings starting this year, starting in the fall, but the wider release is slated to happen early next year. So
Okay.
should be on PBS.
Oh, that is exciting. We'll be in touch. We'll make sure that I want to be a part of helping to promote that. So very exciting. All right. Well, Judeline, same question for you. How are you leading and engaging in Alzheimer's and brain health awareness conversations with communities that you serve?
This is a subject that is really dear to my heart as we are in our family right now. The way I deal with this, especially dealing with a close family, I always tell people, especially my friends around my age, to look at for their elderly parents. Look at the signs, look at the patterns, like we mentioned. For example, for my family member, the very first incident was on my birthday. They remember that it was my birthday, but they called me 4 times, not knowing they already called me to say happy birthday. And then another instance was they worked at a place for 16 years. Same login information. And one morning they went to work, could not remember their login information and had to call their boss to let them know. So these were signs and patterns that we were watching for. And then the third one, which was the breaking point for us, was he was willing to quit his job because he remembered doing things, or if his boss is telling them to do certain things, so they'll probably remember they did it, and then they'll be calling the office saying that, hey, you did not do this, but they think they did it. So these were the breaking point where we had to be like, okay, we had to take action, and the doctor did the screening, and sure enough, that person was diagnosed with early onset Alzheimer's, which is great in a sense. Because we were very proactive about that, they were put on medication, and that delayed the process. As family prepares to deal with what's coming, now we have a little bit more time to prepare to what's coming down the line. And I always make sure that I deal with that. And I talk to my friends, I ask them about their parents. In communities where I go, I always tell them to look out for signs. It's not about forgetting your keys. It's not about forgetting where you put your glasses. These are part of it, but there are deeper meaning. There are deeper things that we need to look out. And I always encourage them to do something. I always lead with that. When somebody asks me, how's so-and-so doing? I'm like, well, I'm glad we did that at the time that we did it. Now we have that person with us for a little bit longer. So I hope you're doing the same with your communities, with your church members, with your family members. And I always make sure that they have the resources necessary. If somebody noticed, oh, I noticed that my mom is doing this, my mom is doing that, I always tell them, when you go to the doctor's office, make sure you let it all out. Don't leave anything out the table. It's up to the doctors to decide if they want to move forward with that, if they want to do further testing. whether you decide not to mention it at all. So this is the way I'm leading right now, and it's, like I said, it's really dear to my heart. I make sure that I have my community really engaged with their elderly parents, patients, so on and so forth.
Yeah, that's really important information. What you just shared, it struck a chord with me about checking on our elderly. I think it's, and then something else that Dr. Joy said about, especially in Black community, there's this sort of responsibility. So what I'm thinking is we need to check on, we need to keep an eye on our elderly folks, not just our relatives that the families were born into, but our church members and community neighbors. I have a neighbor that is a very close friend, and I do kind of, because her adult children live several states away, and I do just kind of, we engage a lot. And if something was to sound or feel different, then I'm in touch with her family members, and it's just the sense of looking out for each other. I think that's a good reminder, and it's really important, especially and we, all of us are serving. We're all a part of, Black communities. We're all serving in Black communities or BIPOC communities, and as a reminder for those that are watching and engaging with us, that there is this extra layer of that we have to kind of remember when dealing with any BIPOC community, elderly members, that is a barrier of trust, that you don't, it's not just given freely, it's earned. So we need to show that, especially as they're aging, if there has to be a conversation like this, I think there's more effort is required. We have to put a little bit more of a effort up front in building that relationship, maintaining that relationship, watching out for signs, because they may not come out and ask, but just kind of, and even how we share resources, just taking a special approach. But as we kind of wrap this up, it's got me thinking about so much more. This has been very insightful for me. So I hope that those that are watching us live and watching the replay and even listening to the podcast, we repurpose this out into the podcast, are thinking about things that they can do. It's wonderful as an organization, as an industry of public health. We have all these programs and systems and so forth, but we have to trickle that down to the individual and humanize it and remember by person, if it's taking those programs and making sure that that person understands this program is available that can help you. The screening is available if you have doubts or questions. I think that that's important. As we kind of wrap up, I'm going to kind of go back around one more time and let each of you share any additional thoughts on this. But Dr. Joy, is there anything additional you'd like to add or wrap up with?
Yeah, I'll just say, I believe when it comes to Alzheimer's and brain awareness, brain health, there is, particularly in our Black communities, there is a different level of advocacy that needs to happen and that is required because there are so many people involved, so many different systems involved. And one of the things that I thought about as we were talking is that, I don't know if they say this in other communities, but I know we say this in the Black community. It's important to get your house in order. Okay. Get your house in order before things like this happen. And when you're able to, as Judeline mentioned, catch things early, it's great to have those preventative measures, right? Have all the legal things in order, who has power of attorney, all the legal implications, financial implications, things that will happen and change in your life, your employment situation. We talk about social determinants of health all the time, right? These are the things that people don't think about until it happens. And so we want to be able to position our communities and position our families to have the resources that they need to say, before anything happens, we want you to be in the best possible place to achieve the best possible health that you can for the situation that you have, and not just for the patient or the person who may have Alzheimer's or dementia, but for the caregiver, for the family support as well.
Yes, that's a great point. And we see this within our own families. I mean, everybody, if you think about it, you've got some part of your family members that are really organized. They are ready. They have everything outlined. They have their plan A, B, and C all together. And then you've got others that may or may not have everything in an envelope under the mattress or in a shoebox in the closet, and any variation in between. But I absolutely agree with you. It's so important to advocate on a whole different level. You're right. Judeline, what do you have in terms of anything to add or anything you want to wrap up with?
Sure. My message is going to be directly to the caregivers, the daughters, the sons, the the caregivers in general, whoever you are, the wives, the husbands and stuff, take care of yourself. It is draining. It is a process. Seeing your loved one go down this path, not knowing who you are when you spent your entire life with this person. Take care of yourself. Do not lose yourself in the process. Be there for them. Guide them throughout the whole process until the time is right. So don't forget to control their diet as well, which is something we do with our loved ones. Take away the sugar. I know it's hard. They're grown. They're going to fight you. But that's a big plus, you know. Take care of yourself. Do what's necessary for you and for your loved ones. And do not lose yourself in the process.
That's excellent. Excellent. Well, thank you so much. This has been such a insightful conversation. I really enjoyed it, and also thank you for opening up. You know, each of you has generously shared on theirs, but it takes a bit to open up and share from a personal perspective. But I think that helps us to be more relatable and to just help people to receive it a lot differently. I know for me, that's been a big benefit. So those of you that are watching with us, again, our names are right here on the screen. So if you're not connected with us already, please do connect. Reach out and let us know anything. We love the comments. We're going to always come back to the comments. We can't respond live. We can see them live, but we can't respond live. But as you watch this replay and share this with others in your network, comment, share your thoughts, any tips, anything you want to add to that, any stories you want to share. We will return to the comments and engage. And we really appreciate that. Continued discussion, and then reach out to us individually if there's anything that we can help you or support you and your organization with through our own consulting services. As we wrap up, next month, same time, the first Wednesday of each month is when we have these roundtable discussions, and we'll be back with a different topic. So thank you again for being here.